Think of a time when hospitals meant little more than crowded rooms, filth, disease, and despair. When a broken bone or a common infection in hospital often killed people faster than bullets on the battlefield. Then picture one woman entering that horror with nothing but conviction, care, and a lamp in her hand, determined to change everything. That woman was Florence Nightingale. Her journey turned hospitals from death traps into healing spaces, introduced a methodical understanding of environment and hygiene, and laid the foundation of modern nursing and public health. In this video, we go beyond her legend. We dive into her theory, her methods, and how her ideas still shape care around the world. If you want real insight on medicine, social reform, and human resilience, keep watching. Florence Nightingale was born in 1820 into a wealthy British family, yet she rejected the comforts and expectations of her class. Instead of social life and marriage, she felt a deeper calling, a moral and spiritual duty to relieve human suffering. Over time, she prepared herself with education and purpose. Her moment of reckoning came during the Crimean War, when she was sent along with nurses to care for wounded soldiers in Ottoman-controlled Scutari. What she witnessed there, filth, overcrowding, disease, neglect, convinced her that the root of suffering lay not just in wounds, but in environment, care, and neglect. It was from that grueling reality she developed what became known as the Nightingale's environmental theory, a radical idea in her time, but one with profound and long-lasting consequences. At the heart of Nightingale's theory is a simple but transformative belief: the environment around a patient, air, water, cleanliness, light, sanitation, plays a central role in recovery or deterioration. She argued that nursing is not simply administering medicines or doing bandages. It is about utilizing the environment of the patient to assist him in his recovery. She identified essential components: fresh, pure air, clean, uncontaminated water, efficient drainage and sanitation, cleanliness of bedding, clothing, ward surfaces, direct light, sunlight if possible, quiet, calm surroundings, good nutrition, and proper rest. In practice, that meant ventilated wards, clean water supply, separation of sick patients to avoid cross-infection, hygiene protocols like clean hands, regular bathing, clean linens, dietary monitoring, minimal noise and emotional attention. A stark contrast to the overcrowded, unsanitary conditions common in 19th century hospitals. Nightingale believed that by restoring these environmental conditions, the body could more effectively heal itself. Illness was not just an external assault. The environment modulated survival. This holistic view recognized physical, psychological, and environmental factors as intertwined arenas of care. In Scutari, the hospital was, well, totally overwhelmed. There were overcrowded wards, contaminated water everywhere, a lack of sanitation, and, honestly, really poor supplies. More soldiers were dying from diseases like cholera, typhus, and infections than from actual battle wounds. Nightingale and her team got to work right away. They cleaned the wards, improved ventilation, brought in clean water, fixed the sewage and drainage, enforced strict cleanliness, provided proper bedding and diet, and above all, cared for soldiers with more dignity and hygiene than anyone had ever expected before. The result was frankly dramatic. Mortality rates in the hospital reportedly dropped from over 40% to under 2% after these reforms. That wasn't just a coincidence. It was evidence that environment, care, and cleanliness mattered even more than we had assumed. But Nightingale didn't stop there. She didn't rely on anecdote or guesswork. She collected data, kept meticulous records. After all, she had a background in mathematics. And she turned numbers into really powerful arguments. Using what became the famous polar area diagram, sometimes called Nightingale's Rose diagram, she visualized mortality data, showing how most deaths were from preventable disease rather than what people believed battlefield injuries. Her data-driven approach convinced military and political leaders to overhaul hospital design, moving away from cramped wards and toward pavilion-style layouts with ventilation, light, cleanliness, and space. This essentially birthed modern hospital architecture and hygiene standards. Through all of that, Nightingale proved that care and environment were as vital as medicine, and honestly, often more powerful than the crude treatments available in pre-antibiotic times. For historians or medical history enthusiasts, Nightingale's environmental theory really provides a lens to understand why disease, epidemics, high mortality, and hospital failures have so often coincided with poor sanitation, overcrowding, and neglect, not just pathogens or wars. It shows us that social conditions, public hygiene, and care systems are just as important as medical advances. For health workers, disaster response planners, or survival-aware thinkers, the core principles still absolutely apply. Clean water, fresh air, decent sanitation, hygiene, nutrition, and environment control remain foundational in emergencies, whether it's epidemics, refugee camps, war zones, or remote clinics. In any crisis, natural disaster, conflict, displacement, applying Nightingale's environmental framework can, honestly, significantly improve survival odds. For public health advocates and policymakers, Nightingale's work is a reminder that investment in infrastructure, clean water, drainage, hospital design, sanitation, hygiene education, pays off not just in individual care, but in lower mortality, reduced disease spread, and, well, healthier populations. For social historians, Nightingale shows how ideas, not just weapons or politics, really do change societies. A nurse's lamp, cleanliness, and data changed the fate of thousands. Her reforms spread globally, influencing public health, nursing, hospitals, and attitudes toward care and hygiene. If you study history or public health, use Nightingale's theory to examine past epidemics and ask, was the environment clean? Was the water safe? Were hospitals basic? So often, outbreaks correspond to neglect of sanitation or overcrowding. If you plan for survival, crisis, or humanitarian response, keep Nightingale's framework in mind when setting up shelters or camps. Prioritize ventilation, clean water, drainage, hygiene, cleanliness, adequate bedding, nutrition, and a calm environment. These are, honestly, low-tech but high-impact measures. If you care about modern health and policy, advocate for sanitation infrastructure, clean water access, hospital hygiene standards, and public health education. Recognize that many modern diseases, not just new pandemics, thrive where environment and care are neglected. If you're a documentary maker or storyteller, Nightingale's story, the woman walking dark wards with a lamp, armed with compassion, data, and resolve, remains powerful. Her theory connects individual care with social justice, medicine with morality, hygiene with survival. That story, honestly, resonates as strongly today as it did in the 1850s. Florence Nightingale was more than a figure of legend. Her environmental theory transformed medicine from superstition and neglect into science, care, hygiene, and structured compassion. She showed that healing is more than medicine. It's environment, dignity, data, ethics, and human responsibility. In every hospital corner, in every sanitation reform, in every crisis response plan that prioritizes clean water and hygiene, her legacy lives on. If this guide has deepened your understanding of Nightingale, her theory, her impact, her lessons, then do make sure to subscribe for more deep dives into history's critical turning points, medicine, survival-aware context, and how individuals changed the fate of millions. Share this with fellow historians, researchers, health-aware viewers, and anyone who believes in the power of knowledge, care, and human resilience.